Let's talk about biliary tract disease. Biliary tract disease may present with pruritus, jaundice, dark urine, light colored stools, hepatosplenomegaly, typically with cholestatic pattern of LFTs, which we did talk about. So, what are the cholestatic pattern? Well, you have increase in ALP and increase in GLT greater than increase in ALT, AST. And you will also have increase in conjugated bilirubin and increase in cholesterol. Primary sclerosing cholangitis. Pathology is unknown cause of concentric onion skin bile duct fibrosis, which leads to alternating strictures and dilation with beading of intra and extra, both the intra and extrahepatic bile ducts on the ERCP. Looking at picture A, magnetic resonance cholangiopancreatography MRCP. Okay. So the other thing you can call it beads on string appearance. Beads on string appearance. All you have is you have the bile duct, and on the sides of that bile duct you have fibrosis. Okay, bile duct fibrosis. And what was involved? Intra and extrahepatic bile ducts. Both intra and extra are involved. Versus in this guy, only the intra is involved. Intrahepatic bile ducts are involved. And in this guy is only extrahepatic bile ducts are involved. Okay. So let's talk about epidemiology. It is classically in middle-aged males with ulcerative colitis. Okay. So this is very classical that you will have an ulcerative colitis patient, and that leads to formation of primary sclerosing cholangitis. Okay. And again, this thing is you will have fibrous obliteration of the bile ducts. Remember the biliary atresia? Same thing. Fibrous obliteration of bile ducts. This is same thing going on with the biliary atresia. Okay. Now here you have an additional features associated with ulcerative colitis, in which you have this MPOA ANCA positive, P-ANCA positive. You have increase in IgM levels can lead to secondary biliary cirrhosis, increased risk of cholangiocarcinoma and gallbladder cancer. Okay. So let's talk about the second thing, which is primary biliary. This was primary sclerosing cholangitis. Now we're talking about primary biliary cholangitis. It is an autoimmune reaction which leads to lymphocytic infiltration plus minus granuloma formation and destruction of the lobular bile ducts. Which lobular? Intrahepatic bile ducts. When you destroy the intrahepatic, again you will have cholestasis and all this. And all of them you have cholestasis and all of these signs, but where they are damaging, it's important. Intrahepatic bile ducts. So here you have again autoimmune destruction of the intrahepatic bile ducts. Which leads to periductal fibrosis in the periportal regions. So periductal fibrosis in periportal regions. And for the top one, we have the fibrous obliteration of the bile ducts with periductal, same thing but different, periductal deposition instead of fibrosis, deposition of connective tissue, which leads to the formation of onion skin appearance. And here we have the periductal fibrosis, and this was the deposition of the connective tissue. Some other things, you have the classically middle-aged females, and additional features are going to be anti-mitochondrial antibodies positive, increase in IgM. Both have increase in IgM, but here the antibody is different. Anti-mitochondrial antibody positive, associated with other autoimmune conditions, for example, Hashimoto thyroiditis, rheumatoid arthritis, and celiac disease. Okay, one more thing they will also say, this also is positive. It also has osteoporosis. While if you think about this, is they have the ulcerative colitis, this has osteoporosis, and also xanthoma or xanthelisma, just the cholesterol, high cholesterols. Okay, moving on with the last thing. What do we have here? We have the secondary bile cirrhosis, biliary cirrhosis. This is extrahepatic biliary obstruction, which leads to increase in the pressure in the intrahepatic ducts. Look, obstruction is in the extrahepatic, although the pressure is increased. Nobody's asking about the pressure. The injuries here, fibrosis and the bile stasis. It presents with known obstructive lesions like gallstone, biliary structure, and pancreatic carcinoma. May be complicated by ascending cholangitis. Although they have, and one more thing for MRCP, they already mentioned what they mean by that, right? But what about ERCP? ERCP is endoscopic retrograde cholangiopancreaticography. Same thing. Cholangiopancreaticography, but is the endoscopic retrograde, while MRCP is magnetic resonance cholangiopancreaticography. Just the names are different, and one of them is it's on top of my mind, but one of them is diagnostic and one is diagnostic and therapeutic. And I think ERCP is diagnostic and therapeutic. It's diagnostic, you can diagnose it and right away treat it. Well, MRCP is only diagnostic. I could be wrong here. It could be switched up. It's just on top of my mind. So, but just know one is both. So wait. ERCP diagnostic plus therapeutic, while the MRCP only therapeutic. My bad, only diagnostic. What do I mean by therapeutic? Treatment. You look at it, you diagnose it, and you treat it right away. ERCP. Okay, that's pretty much all we have for those biliary tract diseases.